Good afternoon. This is Professor Sokol. I'm going to demonstrate Foley catheterization on a female patient. Keep in mind that I have to set up my sterile fields between the mannequin's legs. When you're doing this in a real situation, you would set it up on a side table, but I don't have the capability to film it that way. So I have identified my patient, name, date of birth. I have assessed whether they have any pain or allergies, and I have positioned her legs so that her knees are bent and her heels are together like this to open up the thighs and reveal the perineum. All right. I have the bed at waist height or hip height, and I make sure that the patient is clean, that there isn't stool or anything on the bed. If that was the case before I get started, I would clean that all up, change the pad underneath, and make sure that the perineum is as clean as I can get it. I'm going to do hand hygiene. Okay. And I have my Foley kit. My kit has been repacked. Yours are new. Your kit will have a white overwrap, and it will say the type of Foley, a number 14 French Foley. It will have the expiration date, and it tells you what all is in it, okay? I will take my kit out of the overwrap, and I'm going to make a little cuff here so that I can use this for trash when I need it. I'm going to open up my kit. Now remember, we don't open them on the patient's bed. I'm just doing this because I have to do it in order for you to see it on the film. We would open it on a side table. Okay, I'm opening, starting the first flap to the back, and then side to side, and then the front flap. Okay, and then because I don't want the point hanging over my table and hitting my uniform, I'm just going to turn it squared up like this so that I don't have a problem. Okay? And I'm going to have to move this as long as I don't touch it out of that 1-inch border. Okay? I'm going to move this away a little bit here. The first thing I'm going to touch with my ungloved hand is my drape. And I'm going to take my drape with the shiny side down, and I'm going to try and do it here without contaminating everything. I'm going to put it like this between the patient's legs. And if it does that, don't worry about it. You can fix it when your gloves are on. Okay? Now I need to put my gloves on. I'm going to grab my gloves with my ungloved hand. I'm going to put it off to the side. Actually, I have to move this down so I have room. Okay, I'm going to put my gloves on the way that I showed you. Actually, you can't see me. Do it this way. Put my glove. I'm having a problem with this microphone here. Okay. I want to make sure my microphone isn't getting into my sterile field. Okay. So you can see my gloves here. I'm opening them this way, this way, this way. Now, you don't want the package touching over your sterile field or it contaminates the whole thing. So I have to make sure I keep it well away from my sterile field. Okay. I'm going to put my one glove on. Make sure you're putting them on correctly. Holding it up out of the sterile field. Where'd my thumb go? My thumb disappeared. There it is. Okay. And that should have been pulled up. And then I'm going to reach into the cuff. Remember how I showed you like that? I'm going to keep my thumb out while I'm putting the other glove on. And now I can fix my fingers. And I don't need this, so I'm just going to ignore that. Okay. Now I can take my sterile tray and I don't need this fenestrated drape. It's got a hole in it. I use that sometimes on male patients. I don't want to use it, so I'm going to toss it. I don't need this specimen container. Doctor did not order a specimen, so I'm going to just drop that. Okay. This is my lubricant, so I'm going to squirt that in here or you can squirt it inside the box. And once I have my lubricant out, I can toss that. I have my cotton balls here. Your kit has a betadine pack. We don't use betadine on the mannequins, so unfortunately they took it out. I don't have anything here. But I'm going to tear open the pack and pour it over my cotton balls, okay? And then I'm going to take this apart because I can touch it. I'm sterile, everything's sterile as long as I keep within the inch on the outside. Put that up there so you can see. I'm going to take out my catheter. Now your catheter will have a blue plastic cover. This does not. So in order to take off your blue plastic cover, you're going to hang on to down here, and as you slide the plastic cover off, you're going to hang onto your catheter so it doesn't flop around. Okay? And then you would discard your blue cover. Okay. I'm going to put my inflation water that I inflate the balloon with onto my catheter here, because once your hands are, one is contaminated and one is sterile, you can't do that. You need two hands. So put it on there like that, all right? And we don't pre-inflate the balloons anymore because the silicone balloons can break. So now that I'm done with that, I can put this back here. And I'm going to move this between the legs of my patient. I'm just going to take this blue thing with my sterile hand and get rid of it. Now, this was puffed up here. My hand is sterile. This is sterile, so I can fix it. All right. I'm going to put my box here. All right. And I want to turn it toward my patient. And then with my non-dominant hand, in my case it's my right hand, I'm going to spread the labia, and I have to push down really. Now, my hand is contaminated. I can't touch anything sterile with that hand anymore. I'm going to take the first cotton ball that has betadine on it. I'm going to go down one side of the inner labia, like that, and toss. I'm going to go down the other side of the inner labia and toss it. And then I'm going to go down the center and toss it. And I'm going to toss this green thing because it's contaminated. Toss. And I'm going to take my tray out from the center with my sterile hand because it's still sterile. So I'm going to get rid of that. Toss it. Now I'm going to take my lubricated, which I didn't do. Grab it here. Here's my lubricant. Lubricate my tube. I would have wanted to do that first. And I want to turn this box so that it's facing the perineum, because if that syringe flops out, it will pull the catheter with it and contaminate it. So now I'm going to try and show you how let's see, how can I do this? I'm going into the urethra and passing it without touching the skin or the contaminated glove. Can you see that? I hope you can see that. I'm passing it without contaminating my sterile glove on anything. So I'm not pushing it all the way up to the perineum. It's like an inch away, about an inch away. Okay, pushing that in, pushing that in. You keep going until you see urine. And I did see urine. So for the female, you go in another inch to 2. It's not going to hurt anything if you go in further because the bladder will just let that balloon float. Once I'm here, I'm in, I see urine. These fingers come down and clamp this. Can you see my fingers clamping? You have to do this. If you don't do that, the tube's going to slide out. You just put a lubricated tube into a mucous membrane, it's going to slide out. So I'm done with the sterile part. I'm going to clamp that tube, and I'm going to inflate my balloon using all of the water. This is 10 mLs. Once all of the water is in, I still keep my thumb on the plunger. I can let go of this and let it out. If you don't leave your finger on the plunger, it will start to back out like that. And we don't want that to happen. I'm done with that. I'm going to toss it. I'm done being sterile. They say you can tug on it a little bit. It's been my experience. It will float itself down. Okay? Now I can take this out of the box, and they didn't give me an anchor for the catheter, but if they had, she could put her leg down now, put your leg down. Okay, I would have anchored the catheter like right here against the inner thigh. You want to leave room so the patient can move their leg and the catheter isn't going to be tight. So you want to leave it a little loop there. And I would anchor it around here, and then the bag goes down to the side of the bed on a spot that doesn't move. And remember that little hook I showed you on our beds in the lab? We can use that little hook for the bag, okay? So that's the insertion. Now let's say that the doctor said that I can remove it. So I'm going to get a clean 10 ml syringe. This is a clean one. Okay, I didn't take one out of the trash. And I'm going to have that ready. I have clean gloves on. I explain to the patient what we're going to do. We're going to remove the catheter. I take the anchor off of the leg. I have emptied the bag because I don't want it to be full of urine. It will pull on the catheter. Okay, I emptied the urine out of this bag. I'm going to have a little tissue or something handy because these usually fall right out when you deflate the balloon. I'm going to hook the syringe to this little port here, the same one we inflated it with, and I'm going to draw out all the water. You're going to pull it and let it fill, pull it and let it fill, pull it and let it fill. And when you start to see air bubbles, it means all the water's out. I'm going to hold that, take it off, and then I'm going to tell the patient, just take a deep breath, 1, 2, 3, and we're out. Should be out. There we go. It's just because it's a mannequin, they will slide out. Okay? One thing I didn't tell you, when you're putting the catheter in, you have the patient bear down while you're inserting the catheter. You have the patient hold their breath for a few seconds while you're removing it. And then you just do a little peri-care there. And that's it. Discard everything according to your policy.